Not looking or feeling like myself was one of the hardest things, and I'm so excited to share my story with you guys about a product that I found that I now use almost every day. Hey guys, what's up? It's Lisa, and I'm a pro makeup artist and influencer based in Los Angeles, sharing all things creative, beauty, and wellness. I've always heard the saying that your eyes are the window to your soul, and for years, I didn't want anyone looking at my eyes because I had developed ptosis. Ptosis is when your upper eyelid muscles weaken and the eyelid droops. I lived with ptosis for years and I was so self-conscious of my eyelids. My mom noticed right away, as moms do, and at the time I was modeling and acting, and photographers I worked with noticed as well. I was so self-conscious and I didn't want to take pictures because I was insecure about my eyelids. I decided it was finally time to take matters into my own hands and get surgery to fix the issue. I went in for all my pre-op appointments. I went in for my final appointment. To my surprise, my eye doctor walked in and said, "You know what, Lisa? Let's hold off on your surgery this week. I just got my hands on these new FDA-approved prescription eye drops called UPNEEQ, and I think they might just be exactly what you're looking for." It was during the pandemic and I was staying with my family in Minnesota. I remember looking out the window and snow was falling, and I thought, let's give these UPNEEQ eye drops a try. So I applied a drop of UPNEEQ in each eye and I went about my morning. I made my bed, I got dressed. A few minutes passed and I looked out the window again, and my eyes were more open than they have been in years. And my first thought was, oh my gosh, those eye drops. So I ran to the mirror and it was instant waterworks. I started crying because I looked like myself. I hadn't seen Lisa in years, and finally, in the first time in years, I looked like myself. I remember calling my doctor with tears of joy and just asking to order as many daily doses of UPNEEQ that I could. If you are experiencing low-laying eyelids, ask your medical provider today if UPNEEQ is right for you. It can also be your eye doctor, your dermatologist, your medical esthetician, and even some telehealth providers. It's honestly been the best little lift for me and my eyes.
Important safety information. What is UPNEEQ? UPNEEQ, oxymetazoline, hydrochloride ophthalmic solution, 0.1%, is a prescription eye drop used to treat low-lying lids, acquired blepharoptosis, in adults. What warnings and precautions are associated with UPNEEQ? Low-lying lids may be related to conditions such as stroke and/or brain aneurysm, Horner syndrome, myasthenia gravis, loss of the ability to move eye muscles, eye infection, and eye tumors. Ask your doctor if you have any of these conditions. UPNEEQ is a type of medication that may affect your blood pressure. If you have heart disease, uncontrolled high or low blood pressure, or feel faint at rest or when quickly standing up, you should call your doctor if your symptoms get worse. Patients with reduced blood flow to the brain or heart, or patients who experience eye or mouth dryness due to an immune system disorder, Sjogren's syndrome, should use care when taking UPNEEQ. Call your doctor immediately if you feel your symptoms may be getting worse. UPNEEQ may increase the risk of eye pressure due to fluid buildup, angle closure glaucoma, in patients with untreated narrow-angle glaucoma. Call your doctor immediately if you feel increased pressure in your eye after using UPNEEQ. Do not let the tip of the UPNEEQ vial touch your eye or any other surface. This can help prevent eye injury or contamination. Each UPNEEQ vial is for one-time use and should be discarded after being used. What are the most common side effects of UPNEEQ? The most common adverse reactions with UPNEEQ occurring in 1 to 5% of patients were eye inflammation, eye redness, dry eye, blurred vision, eye pain at time of use, eye irritation, and headache. What should my doctor know about before prescribing me UPNEEQ? Your doctor should review your full medical history before prescribing UPNEEQ. UPNEEQ belongs to a class of medication, alpha-adrenergic agonists, that may affect your blood pressure. Use UPNEEQ carefully if you currently take an alpha-adrenergic antagonist medication to treat heart disease or an enlarged prostate. Patients taking beta blockers or other medications to treat hypertension or an abnormal heartbeat should also be careful when using UPNEEQ. Patients who use a certain class of antidepressant medication, monoamine oxidase inhibitors, should also be careful when using UPNEEQ, as it may affect the way your body absorbs the medication. These are not all of the possible side effects of UPNEEQ. Tell your doctor if you have any side effect that bothers you or does not go away. Call your doctor for medical advice about side effects. To report side effects or product complaints, contact RVL Pharmaceuticals at 1-877-482-3788. You may also report side effects to the FDA by calling 1-800-FDA-1088 or visit www.fda.gov/medwatch. This document has summarized the most important safety information for UPNEEQ. For more in-depth safety information, please review the full prescribing information for UPNEEQ.